Well, hi, my name is Joshua. It says stop screen share. Do I say that, Ellie? To stop screen share. Welcome everyone to racial capitalism and the fight for Medicare for all. We are so excited to be here with you all to learn, discuss, and take action to change our broken racial healthcare system. My name is Josh. I go by he, him, his. Healthcare is important to me because a couple of years ago I suffered a gunshot wound and I knew I needed a lot of care to recover. Even after I got out of the hospital, when I went to apply for my medical card, I was denied 10 times. I was racially profiled as a black man and I had to work so hard just to get the care I needed. That's not right. Our healthcare system is racist, and we are here to change that. A few quick notes before we get started. Keep yourself on mute during this workshop, but we want to know what you are thinking. You have comments or questions, please put them in the chat. We are going to covering some heavy topics today related to racial and harm caused to a black and indigenous community, other people of color. Please take care of yourself in a way you need for the white folks in the space. Be cautious of the space you are taking up. When we say this, we do not mean that white folks should not participate in the discussion or ask questions. It means that you should not be the only one speaking or the loudest one speaking. Our mental health justice team. We are people living with mental illness who are organizing for a universal healthcare system that includes mental health as equally important to physical health. Our team, we often talk generally about racial disparities that show up in healthcare and mental health care. Recently, we've seen that black people, indigenous people, indigenous people, and people of color are 5 times more likely to contract COVID. BIPOC and acronym we use for black people, indigenous people of color. The past few months, our team has recognized that we don't have a firm understanding of why healthcare system is so racist and how the institutions of healthcare has supported and encouraged racism with the care BIPOC receive. Our healthcare system has been racist since the start, but how did it get there? And what can we do to start fixing it? In the workshop, we are going to explore how racism and capitalism work together to support, encourage a healthcare system that often and actively harms BIPOC, and we will dig into how Medicare for All offers a path to creating an abundant care and anti-racist healthcare system where we all get the care we need. Before we jump into before we jump in, we want to hear from you. Put your name, pronouns in the chat and share with us why you choose to come to the workshop today. Current healthcare system. Now let us take a look at our healthcare system. Our healthcare system is a massive complex. It's driven by a few players, of all whom are motivated by profits and big pharma companies, private healthcare insurance companies, of course, and actual healthcare providers. Big pharma. Big pharma includes major multi pharmaceutical companies who develop and sell essential medications to us. Big pharma system is intentionally set up to value the creation of profits over the care of people, which means that people go without or struggle to pay for essential medications they need. Healthcare insurance. Healthcare insurance is a system where we as individuals or our employers pay money for every month to insurance companies to, in the theory, ensure that we get sick. They will help us pay the cost to recover. This includes medicine, hospital bills, post-hospital bills, and insurance can be private insurance like Blue Cross and Blue Shield, and public health care insurance like Medicare and Medicaid. Sure. Like, I got to get the rest of my square is this. So, that slide 2. Okay. Get this. Okay. Like Medicare. Okay. Pause. Okay. I just want to make sure I get, okay. Oh, it is important to understand our healthcare system is messed up. How have y'all all been? Let us know down. How have all y'all been? Let us know. Let down. How many people have been let down by our healthcare system? Have you always been able to get the quality care you deserve at a price you can afford? Take yourself off mute. We want to hear from you. Yep, all of these are examples. Are super clear.
Josh, can we pause on this section because we want to hear from folks?
Okay.
So I'm going to stop screen sharing. Josh, you want to repeat the question that you were asking folks to respond to?
Yes. How have all been let down by our healthcare system? Have you always been able to get the quality care you need, deserve at a price you can afford? Take yourself off mute. We want to hear from you.
Would you want to share with us your comment that you made in the chat, or just read it out?
I'm sorry, were you talking to me?
I was just wondering if you wanted to read out your comment to folks who might not be able to see the chat.
I had to pay $500 for a stool test out of pocket, and I have Blue Cross Blue Shield, and also my partner cannot access any sort of health insurance right now, and it's been a struggle.
So even with private insurance, you still have the medical bills. Has anyone else had that experience?
This is a little different, but for me, I'm under 26, so I should be under my parents' health insurance. But because the private system is so specific, that insurance only works in the state of Oregon and Washington. So if I were to get sick over here, it wouldn't be able to help me. And I'm in Chicago, so it's basically useless for me.
Monique's saying in the chat, she's been fortunate over the past few years, but had to pay a large amount per month. Yep. And then Ellen's saying, I passed on healthcare services because of the cost with even private insurance through my employer. Yeah, so we're sold this idea that we all need to have insurance to make sure that we can pay for what we need when we need it. But then the insurance companies create a system where oftentimes we actually can't pay for what we need, even though we have insurance. Someone else is saying they have medical and dental insurance, but last year they were extremely sick. And with insurance, they'll had a bill of $2,000. That's wild. I know I could not afford a surprise bill of $2,000 for a medical necessity. Feel free to continue sharing stories in the chat, y'all. We want to hear from you. But Les, Josh, you want to take it over to your next section?
Yeah, sure. Okay, yes, all of these examples are super clear. Our healthcare system is working, especially by BIPOC communities, and a lot of that has to do with racial capitalism. I'm going to pass it to Aisha to talk to you about racial capitalism.
Thank you so much, Joshua. Hey everyone, my name is Aisha and I use she, her pronouns. I'm interested in healthcare not only as a public health professional, but as a daughter whose mother lives with mental illness. In our opening session, we mentioned racial capitalism. Has anyone heard of this term before? It can feel a little complicated, but let's dive into it. So racial capitalism is a term that attempts to address the relationship between structural racism and capitalism. Both systems work together and support one another. So to effectively combat one system, the other must be addressed as well. Let's look at each system independently. What is capitalism? So capitalism is an economic system where resources such as food, medicine, or land are distributed among people through buying and selling with money or competition like in a free market. It is a system based on corporate ownership of land and resources. It is based on these few assumptions that one, consistent growth of the economy is possible and necessary for the survival of this economic model. Second, the price of goods is based on the supply and demand of consumers. Third, it assumes there are unlimited resources to ensure this, and that people could access the goods they wanted based on their willingness to pay. And fourth, and most importantly, it's a system that needs to make a profit, in other words, money, in order to function. This means that profit is often put over the well-being of people. It allows rich people to continue accumulating wealth at the expense of workers who are actually doing the production and who are often paid at the minimal amount or not paid at all, and some examples include slavery or prison labor. So this is so that the cost of production is cheap and revenue or profit is high. This also creates a super clear hierarchy of the haves and the have-nots. Capitalism is why we have an economic system where the wealthiest 1% of people control over 35% of all the wealth in this country. Okay, that was what capitalism is. So now let's tackle structural racism. So what is structural racism? Structural racism is a system that routinely and consistently advantages white people while producing negative outcomes for people of color. Structural racism is racism underneath and across society, permeating in its entire history of culture and institutions. Structural racism is the most pervasive form of racism. Structural racism continues because racism is built into the systems we have created in our country. Some of these systems include our education system, our prison system, our housing system, and yes, you guessed it, our healthcare system. Just like capitalism, structural racism relies on a hierarchy where people are considered to be more deserving than other people based on their proximity to whiteness. In other words, the whiter you are, the better your life is allowed to be. It means that unequal outcomes based on race are literally baked into the laws and policies that govern our life. One super clear example of racial capitalism is slavery. The US was built off the labor of Black enslaved people. Almost all the wealth our country first created was dependent on the free and enslaved labor of Black people. Capitalism needs racism to defend its exploitive practices and dehumanization of BIPOC in order to create a profit. Without racism, how can capitalism justify its brutality and violence? Through this history, we have seen racism and capitalism work together again and again and again. And today, we are seeing wealthy white billionaires like Jeff Bezos profit off this pandemic, which is messed up, while his employees, who are often poor, middle, and working class BIPOC communities, struggle and scramble to find the means to pay for healthcare. This is racial capitalism, and this is what we are fighting and working to dismantle. Okay, so that was a lot to take in. So how does this land with you? And what remaining questions do you have? Please feel free to put them in the chat or take yourself off mute. Let's see what the chat's, oh.
I know racial capitalism can feel like a really big issue to dive into. I'm curious if folks have any questions or clarifying questions about what racial capitalism is. Is this a term folks have heard before or feel familiar with? Some yes, some no.
I've heard the term before.
Where did you hear it, Kurt?
Well, when I was with Mercy Housing Lakefront, we used to have tenant leadership, and part of it was dealing with housing, capitalism as far as Medicare, unemployment, stuff like that. For instance, Medicare, which I get, the co-payment can be so high that even with the Medicare, you still cannot get your medicine because of the co-payment. And that's really a big issue and a big concern, because even though I have Medicare and Medicaid, sometimes the co-payment can be so high that even with that, it still, puts me in a bind when it comes to paying for my medication and stuff like that. And then it's just the whole idea of racism when it comes to capitalism. I think it's wrong, you know what I'm saying? Because when it comes to capitalism and, equal equality, I don't think one should choose who gets it or not. It shouldn't be about color. So that's my input on it.
Thanks for sharing that, Kurt. And I'm seeing a few folks who are saying that they just got in. Thank you for bearing with us. We did our best to split everyone up into breakout rooms, but I think folks still got behind a bit. So if you're just joining us, we are just going over what racial capitalism is, and apologies for the lawnmower in the background. And we just heard from Kurt some of his experience around living in affordable housing, the intersection between housing and healthcare, and how even on even with insurance, whether that be public or private, there's still a lot of costs associated with healthcare. So thank you for the folks who just joined us. Thank you for your patience. It is appreciated. Any last comment before we move on about racial capitalism or how it's impacted you? All right, well, I will turn it over to Colette.
Okay, hey everybody. Welcome to those that just dropped in. My name is Colette and I use she, her pronouns, and I'm really happy to be here with you today. So thanks Aisha for going over racial capitalism. As Aisha said, racism is a tool that capitalism uses to maintain its control and power. So one part of eradicating racism within our healthcare system is taking that profit out of healthcare. And we're seeing the harms of racial capitalism in our healthcare system right now in Chicago. I'm not sure if anyone's familiar with Mercy Hospital. Go ahead and raise your hand if you are. Mercy Hospital, Chicago's oldest hospital, recently announced that they are closing their doors in early 2021. So Mercy is a community hospital. It serves more than 50,000 patients a year and employs more than 1,700 people, most of whom are Black and brown. With the closing of Mercy Hospital in 2021, access to medical and mental health care services will be catastrophically reduced at a time when the pandemic has demonstrated that Black and brown communities are healthcare deserts, meaning it's really difficult to actually have hospital or care access. And the closing of Mercy Hospital is a direct example of racial capitalism, right? Because this hospital is closing because it did not generate enough money to justify its existence in this system that we have. So fundamentally, our healthcare system is not based on who needs access to healthcare. It's based on which healthcare institutions can make the most money. Because Mercy serves low-income communities, they rely on public health insurance reimbursements through Medicare and Medicaid, which often means they are reimbursed at a lower rate than previous insurance. So this has led to years of financial struggles for the hospital and has led to their eventual closure. So if we took the profit and the racism out of the equation, would Mercy Hospital still be closing during this global health pandemic? Probably not. But under our current system, capitalism and racism impact every health decision made, including which hospitals open and which hospitals close. So racial capitalism also shows up in the way our insurance system is set up. So our insurance system, as you may remember, is it prioritizes salaried workers for coverage. So those that have a salary, employment, and in the way insurance companies are able to dictate what treatment people get and what they'll cover, which is often based on cost. So I have a question for everybody out there. Has anyone here been denied coverage for a health-related need because insurance said it was not needed or too expensive? I personally have. Pretty much all reproductive health care is not under most insurances, so that's always been out of pocket for me. But go ahead and put your story in the chat. Really curious to hear from everyone here. Let's see if I can. So again, the question is, has anyone here been denied coverage for a health-related need because insurance said it wasn't needed or it was too expensive? I'm seeing mental health services, definitely. In vitro treatments not paid. Reproductive health services. Eliana says my insurance in college cut me off from antidepressants because they didn't want to send them out of state. That's not right. Vivian said, when my uncle retired, he got diagnosed with stage 3 cancer. His worry about being able to pay the copays off of public health insurance led him to try to start a business during this time to access better health insurance. He had to find a way to continue to work to cover his medical costs. That is really hard. Yeah, so we're seeing like this struggle to survive and pay these costs when we would pay anything to stay alive. So how could the free market guarantee an effective healthcare system? So I'll move along, but thank you so much for everyone sharing your stories. We also see this when it comes to paying for medications. So because big pharmaceutical companies have little oversight or control from the federal government, we pay 3 times more for the same drugs when compared to 11 other countries with similar economies. That's 3 times more. So of course, when it comes to accessing medication, low-income communities and BIPOC communities are often left to fend for themselves, often going into medical debt just to pay for an essential medication, or as we saw from Vivian's uncle, starting a business with stage 3 cancer. That just breaks my heart. So we deserve so much better than this system driven by profit and racism, right? We can build this power, and we know the answer. We know what we need, and we can make another healthcare system possible. So I'm going to talk a little bit about Medicare for All. So Medicare for All is one of the ways that we can get closer to this world that we want to see. So who here has heard of Medicare for All? Go ahead and raise your hand or say in the chat. And what do you know about it? Chloe, I see you raising your hand. What do you know about Medicare for All?
What do I know about it? Well, it is essentially this idea, this thing that we're all sort of like fighting towards, in which we would all like have a universal single payer healthcare system. So instead of like having everyone under private insurance and some of us with Medicare or Medicaid, everyone would be covered under this whole like healthcare system in which the government pays for.
You nailed it. Yeah. So it involves universal coverage, which refers to a healthcare system where every individual has health coverage. It's called a single payer system. So that means there's one entity, usually the government, responsible for paying for Medicare coverage for everyone. And the current Medicare system, like when we say Medicare for All, this plan would take our existing Medicare program, but would expand it and improve it. So a few fast facts for everyone about Medicare for All. It's patient-centered, so we have the choice of what doctor we see. There's no out-of-pocket costs like copays or premiums that we all normally pay. This means you could go to the doctor, even a specialist, without having to pay anything for your visit, medical tests or medication. That just seems like a dream. But it's not. It could be a reality. And it's not tied to employment. So everyone in the US would be covered regardless of their employment status. And this is massive, right? Because under capitalism, we are taught that our worth and our value comes from how much work we do, how much we are able to produce through our labor. And under Medicare for All, it assumes that everyone's health and everyone's personhood would be inherently valued because you exist, because you are a person. So funding for new hospitals is kind of a separate part of this, but it's still built into the bill that we're going to be talking about, and with a focus on putting a lot of hospitals in rural areas. The VA and the Indian Health Services remains intact, and essentially under this system, it assumes that healthcare is a human right, which is what we're fighting for. So Medicare for All is not for profit, because often the big question is, but who would pay for this? Where is this money coming from? So actually the cost would be less to us. 95% will see a decrease in costs, and the top 5% of income earners, the top richest people, may see an increase. But in this plan, there would be a 4% income-based premium based on households, which would raise $3.5 trillion over 10 years. So just to like put it in perspective, a typical middle-class family would save over $4,400 under this plan, because no one would be paying copays. No one would have a deductible or a premium or medication costs, or at least they would be significantly lowered. So, but there are a few barriers to passing Medicare for All, right? Like, as we have seen, it's opposed by some big players out there. The for-profit, big pharmaceutical companies, insurance providers, and even some large hospitals. So all these groups would stand to lose massive profit if we adopted Medicare for All, and are pouring money into anti-Medicare for All campaigning. So this is what we're up against. We know how big these barriers are, and yet we are brave enough to fight to overcome them still. And let's not forget that many of our elected officials take millions of dollars from healthcare industry to represent their interests in DC. So this is a big fight, but we're in it. So I just want to ask one more question to everybody. How would this pandemic be different for you if we had Medicare for All? You can go ahead and take yourself off mute. If you say something in the chat, I'll read it out. So either one you feel comfortable with. How would your life be different or this pandemic, if we had Medicare for All?
Well, I'm Kurt, and for me, it would help me because, like I said, when it comes to the co-payment, I wouldn't have that issue. Like, for instance, I needed, I had a rash, and it required me to see a dermatologist. And I was under the impression, by me having Medicare, that I could see the dermatologist and I wouldn't have to pay. And when it came to me getting the prescription that for the medicine that I needed, they telling me that I needed $100. So I couldn't get it. So if the Medicare for All were to take effect, it would help a lot of people, especially poor people. Because like I say, even though I do have Medicare and Medicaid, when it comes to the co-payment, it still puts you back into a bind, because what's the sense of getting a prescription for a particular medicine if you're still not able to afford it?
Yeah.
So that's been my experience with it.
Thank you.
And I really hope this bill passes.
Yeah. I'm gonna shout out some people in the chat. So Jen says people would engage in a lot more preventative care. That's so true, like yearly physicals. April said people would be less afraid to seek healthcare. That's also super valid. Gina says, I'm in a high-risk group. I've had more confidence and fewer people were untested and spreading the virus because everyone had medical care and access to testing. Yeah, thank you so much, everyone, for sharing. For the sake of time, we're going to move on, but I really appreciate your stories and your discussion. So the fight for Medicare for All is huge. Like I named the big players that we're up against, but we're still in this fight, and it's still totally possible for us to win. So we need universal healthcare system now more than ever, and many allies in Congress are working to make a universal single payer system a reality in the US. So 2 years ago, Bernie Sanders introduced Senate Bill 1129, and Pramila Jayapal introduced the House Bill 1384. So these are real bills sitting in Congress that could be passed at any time if Congress had the will to do so. So in organizing, it's important to remember and stay grounded in the world as it is, in this reality, while we fight for the world as it should be. We know this is a long and hard fight to win Medicare for all, but it's now or never, and our system cannot continue as is. It's up to us to build a movement that we will win Medicare for all, but how do we get there, especially in a time like now? One way to, kind of set this country on a trajectory towards Medicare for all is by expanding Medicare right now to cover more people and create a larger base of people who benefit from Medicare. So this is especially important under COVID when our Congress has taken very few steps to expand access to healthcare at all. So right now there are 2 bills sitting in Congress that would radically expand Medicare access and would empower Medicare to cover millions of more people who currently don't have healthcare. So they're called the Medicare Crisis Program Act and the Healthcare Emergency Guarantee Act. So the Mental Health Justice Team has been organizing with our national affiliate, People's Action, to put pressure on members of Congress to include one of these bills in the upcoming stimulus package. So thanks so much for listening to me. I'm going to pass it back to Aisha to take us home and talk more about what we can do about those 2 bills. Aisha?
Thanks so much, Colette. So let's take a look at where our North Side Illinois Congress people stand on healthcare expansion in a global pandemic. Many of our folks have signed on to both bills and have agreed to push for their inclusion in any upcoming stimulus package. But Senator Durbin, the second most powerful senator, still has not signed on. Instead of supporting Medicare expansion, Senator Durbin proposed and advocated to subsidize COBRA insurance, which is an expensive private insurance option that would cost more than it would to expand Medicare to all the people who are currently unemployed. It's wild. We have spent the summer building power to pressure Durbin to act for his constituency. We invited him to a congressional town hall in May, but he declined. We've made hundreds of calls and emails to his office demanding his support for Medicare expansion. We organized an in-person action on Durbin in July to call out his inaction. We even spoke to his director of healthcare policy, who told us Durbin supported a universal healthcare system, but he wouldn't sign on to Medicare expansion or Medicare for all because it would damage his relationships with Republicans. Excuse me? That's ridiculous. But that's what Durbin is worried about right now. Mitch McConnell and Donald Trump. That's not right. It's bogus. And our communities deserve so much better leadership. And we need your help right now to make sure that Senator Durbin knows that we are going to keep him accountable to his community. It's his job. So take out your phone and open up Twitter. Right now, Eliana is going to post a simple tweet in the chat that you can copy to call out Durbin for his inaction, and make sure to tag him to show our power for Medicare expansion.